I'm Dr. Eric Rudd, and I'm an orthopedically trained physician who for many years did general orthopedics, and so I fixed knees and hips, meaning hip and knee replacement. I fixed fractures, I did ACLs, I did bunions on feet, I did carpal tunnel. I did all those things in the community setting, and I did 17 years of general orthopedics. So that's a breadth of experience. And then in the last 8 years I've gone non-operative, and that was partly out of personal choice. I have 4 children that I like to put a lot of time into their raising, and I made a transition. Now that transition was somewhat trying in that I miss surgery so much and still miss that rigor and the procedural aspect, but I have preserved the procedural aspect, and I still like to give therapeutic shots, and I still would work with my hands, stay in the game. So I'm still offered, I'm still board certified to get back into ortho, and I get emails daily from headhunters to go back into general ortho. So it's actually a decision point that I'm always at to go back. But right now I'm working with Rejuv. I came here because of the offer from Dr. Baumgartner that he has built a kind of a new paradigm in musculoskeletal health. And what I was building in my last place, where I worked in a neurosurgery clinic as an orthopedic spine and hip and shoulder consultant, was I like to work with med students, and I like to engender the thought of musculoskeletal medicine as a discipline. So if you're not doing surgery, how can you maximally help the patient to move forward right up to that date of surgery coming in? And that's what I've been working on for years. And I had the 4th year University of Minnesota students would come monthly, and we would talk exams and talk about findings on MRI and put it all together. So that's been my passion, is I like to see patients progress, students progress, understanding progress in the field. And then Dr. Baumgartner seems to have been brought that together in a kind of a brilliant way. And we'll just say it, he's kind of hit it out of the park. And for musculoskeletal medicine, he's as close to the perfect paradigm as I've seen. I just think so. Meaning that he offers the new biologic treatments, which is PRP and stem cell, which are happening around the world, and he's championed that cause, and I've seen his outcomes, and I'm reading the literature that they're coming. And a lot of the big entities like the Mayo Clinic and Emory are following that trail and doing these treatments, so they're real-time important to patients. And so I'm seeing that, and it's procedural, so it meets a lot of my requirements for a fun and interesting thing, short of surgery, as I've mentioned. And then it does still involve the heavy thought process that leads to procedures, the workup of patients, hearing them out. I like the crosstalk. I like to get down to what's really going on. And then at the end of each day, clinic day, I like to have their problems rank filed, so we know exactly their diagnoses, and in rank file, which one bothers worst. And then attack them in the ways that are available, therapies. And then I also like Dr. Baumgartner's holistic approach to wellness with dietary, nutritional, hormonal wellness balances, and his emphasis on exercise, which I think is brilliant.